During the Rio Olympics, a swimmer and gold medalist Michael Phelps' picture with a circular mark on the shoulder and his back became so viral. Suddenly, cupping therapy garnered a lot of attention across the globe. As a coach, therapist, or trainer, what physical therapy techniques and strategies do you think are available for sports rehabilitation? If you're looking for answers to these questions, you're in the right place. Welcome to the NPTEL offered course on physical medicine and rehabilitation in sports, and today's lecture on advanced physical therapy techniques. With me, Wing Commander Chandrasekhar Guru. I'm a sports medicine physician from the Department of Sports Medicine, Armed Forces Medical College, Pune. The learning objectives of this lecture will be mainly focused on advanced PT techniques, what are the need and goals in sports injury rehabilitation. I'll highlight various components of advanced rehabilitation. What is the clinical rationale for using such techniques in the accelerated return to sports protocol? We'll discuss certain use case scenarios. We'll also dwell upon certain practical aspects in terms of using this various advanced physical therapy techniques that are available. As we discussed in the previous lectures, this is a changing paradigm in terms of physical therapy in sports, wherein there's always a constant need in involving various rehabilitation practice as per the demand of the sports. From a passive care of physical therapy now has become more of a technical integrated protocols with objective criterias for an accelerated return to sports. It is more of an evidence based, which is again athlete centered approach. The goals have also been reframed in an advanced physical therapy setting where a basic aim of restoring function is also augmented with re-injury prevention, accelerated return to sports, personalized approach towards the athlete, and an integrated approach of both data from the objective measurements and evidence based practice. So, giving a comprehensive goal for advanced physical therapy techniques. So, before going on to the various advanced techniques that are available to choose from, it is important to understand what are the components of an advanced rehabilitation program. The component starts with an objective assessment tool starting from an handheld dynamometry, electromyogram based recordings to give feedback. You have isokinetic dynamometry to measure the torques and the asymmetries. Motor control training forms a major important component of the advanced rehab, wherein you look at neural training given more emphasis prior to the strength training aspect as such, and the quality or the form in which the movement is performed is given more emphasis more than the quantity or the number of sets the individual is able to do. Management of load has become an important aspect in the incorporation of advanced rehab. Considering the fact that sports injuries also have overuse injuries, it is important to incorporate this aspect in the rehabilitation protocol as well. So it is the data that is derived are mainly from the wearables which have multiple advanced algorithms and AI based and machine learning based algorithms to give you various variables on various activities that you perform on the field, and based on that you have a calculation of the load, that is external load that one actually undergoes during training, giving a simple acute to chronic load ratio. Further, there is an integration from the functional movement towards more of a sports specific performance. So this integration has led to more of a functional phases in from a routine rehab to an advanced rehab, and that has resulted in more of a collaborative work between the coach and the athletic trainer and the therapist. So that's how the advanced rehab as is a multidisciplinary with a team approach. With such a background, what is the rationale in using advanced techniques? See, there are so many advanced techniques that are available, but then it is not always necessary that all those techniques have to be used. So they're not required for all the patients. It depends on the phase of rehabilitation. It depends on the tissue healing principle, and the specific phase in which the individual is presently on. It depends on the extent of the injury, and also the other factors, especially the demand of the sports and the team as such, from the coach and the administrators. So all this aspect has to be taken into consideration while employing or using a specific advanced technique in the sports rehabilitation. It also depends on the accessibility to such techniques and the facilities that are available to have a backup. It also depends on the athlete's level at a professional, commercial, sporting team level, or a sports club level, or to an amateur recreational level. So that also decides on the choosing of the advanced technique. And it is important to match the method to the individual to have a personalized, effective outcome at the end of the sports rehab program. So moving ahead with certain advanced techniques that are being employed in physical therapy during the sports rehabilitation, I will be covering certain techniques starting from which can be used in phase 1, then subsequently in phase 2, phase 3, and then kind of used in screening for injury prevention. So in the phase 1, most important emphasis is given on neuromuscular re-education and training. And uh, to restore that, you have basically this, because of the disruption in the sensory receptors, the muscles are kind of weak and they're inhibited, and the control is also very poor. So it is important to focus on this aspect to make the individual relearn the motor control. So that can happen by reducing the complex movement into small simple movement, and gradually progressing it and aligning it with the phases. Say an easy example which I quoted in the previous class as well: if someone has an ankle injury, it is important that neuromuscular re-education has to be instituted right from phase 1 onwards. So how do you use practically, how do you employ this? So in phase 1, once a pain-free range of motion is there, even with a partial weight bearing, you can start kind of giving the proprioceptive senses joint movement, in terms of asking the individual to perform various range of motion exercises, like performing an alphabet using the great toe, and gradually understanding the movement. Once the movement increases, you go on to progress to able to stand on both legs over different surfaces. That gives sensation of different surfaces, from the sole of the foot to the individual, and the position of the joint. And the individual has to look at the mirror to see how much is the kind of variation in terms of the position. Subsequently, as the individual gains more strength, the range of motion improves, pain decreases, swelling decreases, you can go for a single leg balance, wherein the individual maybe has to compare with the uninjured limb and try to reach that level over a period of time and equate with the uninjured limb. Once that level of neural control or the balance is reached, then subsequently you can progress it with changing the surface on which the single leg balance is done. Or you can also change by increasing the level by asking the individual to close the eyes. So that's the kind of neuromuscular re-education that has to be progressed, which is aligned with the different phase and the different endpoints of different phases of rehabilitation. Generally, in an advanced rehab setting, on an high performance setting, the advanced technique used augments this particular re-education by using EMG biofeedback and balancing tools. You have various equipment which gives you a visual feedback on how much is the kind of balance that you have achieved. So that gives a kind of a biofeedback objectively, both for the patient as well as for the therapist. So subsequently, it becomes easier for the individual to learn it faster. When we speak about learning, it is also important to understand the process of learning. The process of learning a motor control or movement happens in 3 different stages. Starts from cognitive stage, associative stage, and then autonomous stage. It's very simple. In the cognitive stage, the individual is more receptive, is not doing it, but then the therapist explains each and every aspect of the movement, importance of the movement, and then the basic theory behind it, and then gives a demonstrate how the movement has to be done with the focus on the form. So that is the cognitive stage. Once the individual absorbs all these facts and the knowledge and of all these aspects of the movement, then the individual tries to associate himself or herself. So the individual is made to do and try to match up with the demonstration that has been done with the visual feedback or feedback given by the therapist to the patient. So the association is there, and the subsequent stage will be an autonomous learning, wherein the individual tries to correct himself or herself and tries to, even before committing a wrong movement, the individual corrects it and then tries to perform the correct way of doing it. That's the autonomous stage. So it is important to understand this, because that is how you can kind of progress in a way that the individual reach that stage of autonomously able to kind of do this particular learn the movement and do it properly. Neural control is again important. For in order to have a neural control, it is necessary that you break them into smaller movements and then gradually increase the complexity. So this inclusion of this has really helped in terms of reducing the risk of re-injury in long-term injury prevention programs. So it can be used by training it right from phase 1. You incorporate this also in phase 4. Thereby you also help in kind of preventing a re-injury subsequently, right? Moving ahead with the next kind of advanced technique is aquatic therapy. Aquatic therapy has been used widely in different population group. It is basically to facilitate a functional recovery and therapeutic exercise using water medium, and it is mostly a pool-based therapy, wherein wide range of population can be used, starting from pediatric to orthopedic to neurological to cardiopulmonary patients. Just need an harness to support them, and the kind of level of resistance can be given based on the level of immersion. As you increase the depth of immersion, the resistance offered by the water to a movement is increased. So if you want to have a lesser kind of a thing, then you can reduce the depth of immersion, and it helps in facilitating the range of motion, and it gives a 3D kind of 3D three-dimensional planar movement. So which can be done with a reduced weight bearing activity. So with the buoyancy that is there with the water, it also gives an additional advantage in terms of early rehabilitation. So aquatic therapy can be used in your end of phase 1 or even the early of phase 2 to initiate an early mobilization and early movement in the injured area. And not only that, by using aquatic therapy, you are also able to improve the functional response, or in fact in terms of increasing the cardiorespiratory endurance as well, also a form of relaxation for the individual. So that's the advantage of using an aquatic therapy. This is another important or a more recent usage of this particular advanced technique, that is the blood flow restriction training. What is blood flow restriction training? So you generally kind of accrue maximum benefit of strength training when you do high intensity training, right? So high intensity training can result in concept of hypertrophy of your muscle, but then that can be done only if you have reached a certain level of basic strength and conditioning, and thereafter you go on with the high intensity. But then what if I can use a low load with some other concept to accrue the same kind of hypertrophy benefit? That is what is happening in blood flow restriction training, wherein to produce results similar to kind of high resistant training, you combine low resistant training with blood flow occlusion. The concept is kind of uh, you can have like kind of occlusion of the blood flow causes reduced blood flow, whereas the venous flow is kind of occluded, and that can be occluded by using a kind of blood pressure cuff also to increase it, to a level, and then the blood flow is occluded, whereas the artery flow is not occluded to a level that the artery flow is still maintained. So there is a reduced blood flow, and the venous flow is occluded because of the increased pressure. So this causes an hypoxemic environment, and that is found with when it is combined with a low load resistance to principle of say low intensity of 20 to 30% of 1 RM of that particular region, with an high repetition, number of repetitions will be more, and short period of rest with 30 seconds. So such kind of a low load with a blood flow occlusion is found to increase the hypertrophy of that particular region that's being exercised. So where you can use it, you can use in people who are in early stage of phase 2 itself, wherein you can restore the basic strength, start them when they're able to do low load resistant training. You can also combine it with the blood flow restriction training that can help in hypertrophic result. But then one of the thing that one has to take care is that the blood pressure that is required to cause that occlusion has to be monitored. If the occlusion is so severe, then it may even compromise arterial supply. So if an individual has a peripheral vascular disease, it can end up in kind of limb ischemia as well. So it is important in that way to identify what is the pressure that is required to cause that desired thing. Hence it is advanced, wherein now techniques are available. Rather than using a generic methodology of 1.2 to 1.5 of the systolic blood pressure, the therapists or the high performance centers using blood flow restriction training use ultrasound to identify the pressure during which the blood flow reduces. So that particular pressure varies for different region, depends on the size of the cuff, and that gives an idea that what the individual response as well. So that gives an idea how much is the pressure that is required to cause that occlusion, desired level of occlusion, and have that hypertrophic thing. So that is about the blood flow restriction training. Another important advanced technique that we have in physical therapy is isokinetic testing and rehab. This is a very expensive equipment to say so, but then it is one of the common feature in high performance center, wherein an isokinetic testing equipment you use to objectively measure the torque that is produced by that particular group of muscle, and it is used to compare with the other side and assess the symmetry of the different joints in the different group of muscles. So they measure the torque, the velocity, symmetry, and provide an objective feedback to the therapist as well as to the feedback to the patient as well. It aids in monitoring the stage-wise criteria that is required. So if you have this equipment, it is easier to have fixed objective criteria to progress from one phase to the other phase in different various kind of contraction or type of muscle activity. It can be a contraction based concentric based activity, or can be an eccentric based activity, and the torque produced can be assessed in different type of muscular activity. So that gives a good idea about the requirement for the demand of the sport, and accordingly you can progress from one stage to the other stage as well. It can also be used as one of the criteria for return to sport as well. Say commonly used in field of football, wherein isokinetic devices are used to measure the hamstring strength and quadriceps strength, and compare them as an hamstrings to quadriceps ratio. So you can do it in an injured limb as well as a non-injured limb. So you can have a comparison from side to side as well, or as a ratio in the same leg between hamstring and the quadriceps. So generally it is between 0.5 to 0.8. So that gives an idea like how you have progressed, and can also set up a benchmark level to have a certain level of hamstring strength in order to prevent recurrence, or in order to also prevent injury. So that's the utilization of isokinetic testing in injury prevention, in kind of progression to level of phases of rehabilitation, also as a criteria in terms of return to sports as well. Another important aspect which has gained so much of importance of late is the eccentric loading techniques, especially in terms of certain conditions like tendinopathies, using the mechanotherapy concept. So the goal is basically to dynamically load the muscle, causing to lengthen and produce more force. So it is seen that with eccentric activity, the force produced is more physiologically as compared to the concentric activity. And it is also important in certain sports where deceleration forces are involved, because whenever a movement involves the deceleration control of a particular group of muscles, the force production is mainly by eccentric activity. um, so it is generally, as it is logical to believe that if the force production is more, obviously it cannot be started in the initial phase of rehabilitation. It has to be started towards the end stage of rehabilitation, probably in phase 3, where the individual is all set with basic level of strength training, restored function of activities of daily living, and then now ready to go into the sports. So that is where advanced strengthening technique will involve eccentric kind of loading techniques. So it is found to improve sports performance by especially in sports involving high intensity deceleration, change in direction, quick change of directions, mainly in football or sprinting activities, and also an integral part of tendinopathy rehab, which I had mentioned earlier. And it also has been shown to prevent re-injury in cases. So it is also incorporated as an injury prevention program. So and so in hamstring case of hamstring injuries, where you have Nordic eccentric activities that are used to basically to build up the eccentric technique to increase the eccentric load of the hamstring. And you also a drawback I would say is, as we know, physiologically, when there is eccentric contraction, there is also micro trauma that happens, which also leads on to something called as delayed onset muscle soreness. So all of us would have experienced this delayed onset muscle soreness after say climbing downhill, or doing an activity with heavy weightlifting, and lifting the weight down. So such kind of activities increases the delayed onset muscle soreness because of the eccentric kind of contraction that is involved. The another important advanced technique that is again very important in terms of improving the sports performance in terms of explosive power is plyometric training. Plyometric is a concept which is used in high performance sports, wherein you use the eccentric contraction with a rapid followed by a rapid concentric contraction. So something like box jumps, wherein you stand on the box and then you immediately do a jump, and then you again do follow it up with a subsequent eccentric activity as well. So the box jumps, skips, hops, hurdle jumps, these are all lower limb based activity that are common in plyometrics. You can also use medicine balls or something like a plyo push-up for upper body based plyometric training. But then these involve extreme level of strength requirement. So obviously these are used in the advanced stage of strengthening phase of rehabilitation. So it is in phase 3, just prior to kind of the individual is fit to be tested for return to sport. So that is the time when plyometric training is introduced to basically work on the power generation within the shortest possible time. So because of this kind of high level of complexity and strength activity involved, it is prone for injuries as well. So a basic level of strength is required uh, to be developed before implementing a plyometric training. And again, because of the eccentric kind of activity involved, the onset of delayed onset muscle soreness is also there in such kind of activities. Another advanced technique which is prevalent in the physical therapy setup is the instrument assisted soft tissue mobilization. It's part of the manual therapy, wherein instead of using your own digits or fingers, you go on to use instrument to assist you in soft tissue mobilization. So as it conveys, it is commonly used in to break the scar tissue and facial restrictions. So it is logical to conclude that this is mostly used in the remodeling phase or the end phase or in chronic phases in soft tissue diseases. So it aims in kind of increasing the mobility and promote healing in chronic cases. You can use instruments, firm instruments like a golf ball, which is easily available, even to a kind of a handled roller that can be used. A foam roller also can be considered as a firm tool, which also falls into the instruments as a soft tissue. And with more and more utilization of this, you have commercially available ISTM tools as well to promote kind of mobilization. Caution has to be made in the time kind of pressure that is applied based on the individual feedback. Moving on to the next technique is dry needling. Here, dry needling is basically ancient form of variation from acupuncture, I could say, Chinese form of medicine, wherein the monofilament solid needle is inserted onto the trigger band or a trigger point to basically elicit a twitch response. The twitch response is considered to be a desirable effect to have a better outcome. And the proposed mechanism is that it stimulates the free nerve endings to release certain chemicals and helps in pain relief. The twitch response is also considered to also initiate a local spinal reflex and thereby helps in relaxation and decreasing the pain as such. So there's good level of evidence that's coming up in terms of use of dry needling in chronic low backache, neck and shoulder pain as well. As we come on to the other important advanced technique that which we started the lecture with was the cupping therapy, right? Cupping therapy again is a form of a traditional medicine that has been used since ancient time. Is basically to create a vacuum force to cause beneath the small vessels of the skin on the subcutaneous tissue, which causes kind of opening up of the blood vessel and then causing vasodilation and even extravasation of the blood from these vasodilated blood vessels. There are two types of technique wherein wet cupping and dry cupping. In wet cupping, even small superficial pricks are made so that with the vacuum suction there is also kind of blood coming out of it as well. Since it involves a lot of contamination that can happen, it needs sterilized technique that needs to be followed. Generally it is the dry cupping that is preferred, wherein you don't make any cuts, but then there is because of the extravasation of the blood cells and the blood products, there is a circular rash that can be seen on the point of application of these cups. That is what you would have noticed in the pictures where Michael Phelps had certain circular rash. So the dry cupping is the preferred because of the non-invasiveness. It is generally used in chronic skeletal, musculoskeletal, soft tissue conditions with pain, and it is supposed to hypothesis that it reduces pain by pain control theory, and also because of the vasodilation effect there is also release of nitric oxide which increases the blood flow. This flow of new blood and kind of extravasation of the old blood from the region is one of the hypothesized concept. Moving on to the another advanced technique which is more prevalently used in terms of screening and injury prevention program is functional movement screen. As we discussed, the physical therapy has progressed towards more of integration of functional movement and performance. So using certain functional movement methods or certain tests, a scale has been derived to assess whether the individual has a proper function to perform certain activities or not. So that helps in identifying deficiencies, movement deficiencies. So there are 7 movement patterns that are used, like deep squat, hurdle step, inline lunges, active straight leg raise, trunk stability push-up, rotatory stability and shoulder mobility. So these 7 movement patterns are scaled from scaling of 1, 2 and 3, and accordingly they are given scores. A score of 14 is considered good. Beyond 14 the deficiencies are less, but then less than 14 there is a requirement to correct the deficiency. So this is also found to have good way to guide exercise prescription and has been used as a good screening tool to address this movement deficiency during the pre-season per se. The last technique which I feel is an important addition to the armamentarium of advanced physical therapy is virtual reality in rehabilitation, wherein it is a fun and an engaging way, especially young athletes, to kind of be motivated in a sports rehabilitation program. It is more useful in cases of concussion, neuro, and balance rehabilitation. And it also gives a immediate feedback to the individual to perform. So thereby, the individual need not perform the task and then wait for the therapist to correct. It can be corrected on the go itself. So that gives a good kind of feedback, biofeedback, and it helps in faster kind of recovery as well. So that's adopting technology in rehabilitation. So let's see a case scenario. Moving on to the same case where you are part of a team of football players, and one of the kid develops a hamstring related strain, and immediate acute phase treatment was given, and he improved well and was able to walk pain free and able to perform the activities of daily living, and progress to kind of phase 3 where he was advised to do various sport specific drills. And as a coach or a trainer or a therapist, can you list out the advanced PT techniques that can be used for an accelerated return to play sports decision in this particular case? So you can think over before I kind of give my kind of opinion on this particular case. So is an young athlete probable hamstring strain. In the phase 1, cryotherapy modalities can be used, including aquatic therapy. Rehabilitation can be started off with partial weight bearing, then progressing to a full weight bearing with 3-dimensional movement. In phase 2, at the early stage, we can start with the blood flow restriction training in order to have accelerated effect of hypertrophy. You can use isokinetic assessments in all these various phases to also measure the hamstring is to quadriceps ratio. This guy being a footballer, the hamstring strength is an important predictor or risk factor for re-injury, and we've seen about there's an increased 5 to 7 times chance of having a re-injury in hamstring cases. So it is important to assess it objectively. If I have access to an isokinetic device, definitely an hamstring is to quadriceps ratio has to be checked for the same limb as well as compared with the uninjured limb. Eccentric Nordic training can be introduced in the phase 3 to advance the strengthening effects. Now we also have eccentric Nordic boards, which also gives you the objective value of the force, eccentric force that is being generated. So that gives an objective value to kind of progress the training. Plyometric speed training definitely has to be incorporated to avoid a re-injury. That's to summarize the innovation along with evidence help in giving better outcomes, and adopting them to the individual need is the need of the heart. The tailored rehabilitation is essential. Stay updated with the emerging tools and use them appropriately. Objective assessment definitely gives an additional extra edge in terms of feedback to the patient as well as to the coach. And these advanced PT techniques can be used in screening, injury prevention, early rehabilitation, and an accelerated return to sports protocols. For those of you who are interested in in-depth learning, following all the references that I have shown there on the screen. Thank you, and Jane.